Republic Act No. 8749, also known as the Philippine Clean Air Act of 1999, was established in order to safeguard the health of the Filipino by promoting pollution prevention. It recognizes that a clean and healthy environment is for the good of all, and therefore should be the responsibility of all. The country's geographical location and its being an archipelago keeps the country's air generally clean, as ocean winds keep pollution at bay, but not in highly urbanized areas where air pollution is largely caused by vehicular and industry emissions. And since 80% of the pollution load is contributed by mobile sources or vehicles, much of the remedial measures will target motor vehicles through strengthened anti-smoke belting programs by local government units and strict implementation of emission tests prior to registration by the Land Transportation Office. In 2014, the Philippines' air quality ranked 85th out of 178 countries, according to the Environmental Performance Index of Yale University and Columbia University. Latest records from the DENR Environmental Management Bureau showed that the air quality situation in the NCR has reached 130 micrograms per normal cubic meter in terms of total suspended particulates, an indicator of dirty air. This is still way above the maximum safe level of air pollutant concentration of 90 micrograms per normal cubic meter. To improve air quality, the DENR has partnered with the transport sector to facilitate the shift in fuel used by cars in Metro Manila. The agency is promoting a shift from Euro 2 fuel to Euro 4, a globally accepted European emission standard for vehicles that require significantly lower sulfur content of 50 parts per million compared to the current Philippine standard of 500 parts per million. Benzene in Euro 4 gasoline, on the other hand, is only 1% by volume compared to 5% in Euro 2, making cars that use it less likely to emit smog. Starting January 1, 2016, all new passenger and light-duty motor vehicles should comply with Euro 4 emission limits. Furthermore, the Department of Transportation and Communications plans to modernize the country's transportation sector by phasing out 15-year-old public utility vehicles, including jeepneys and buses, to address the pollution caused by their old engines. The World Health Organization reported that in 2012, around 7 million people died, 1 in 8 of total global deaths as a result of air pollution exposure. Exposure to contaminated air produces unfavorable effects on our health, productivity of an unaffected individual, and overall quality of life depending on concentration of these pollutants and duration of exposure. Air pollution has both acute and chronic effects on human health, affecting a number of different systems and organs. It ranges from minor upper respiratory infection to chronic respiratory and heart disease, lung cancer, acute respiratory infections in children, and chronic bronchitis in adults, aggravating pre-existing heart and lung disease. Our country spends 7 billion pesos annually treating pollution-caused illnesses, and according to the DOH, more than half of medicines sold in Metro Manila are for upper respiratory diseases. Currently, steps are being made to implement change. Some cities have promoted the use of alternative modes of transport, such as the bicycle for Marikina City and electricity-powered jeepneys for Makati City. The Department of Energy has strengthened its drive to use cleaner fuel, reducing considerably the potentially harmful content of fuel, such as benzene in lead gasoline and sulfur in industrial diesel oil. It has also promoted the use of alternative, cleaner fuels, such as biodiesel blends, especially in government vehicles and public transportation.